Using castor oil before bed can clog pores and irritate your eyes when used the wrong way. Follow these 6 safety rules tonight to protect your skin, soften dry areas, and avoid common mistakes. Welcome to the FreshFuel Guide. Castor oil before bed is becoming popular as a home remedy for skin and hair care. But when it is applied too heavily, to the wrong area, too close to the eyes, or without a patch test, it can clog pores, irritate the eyes, trigger breakouts, or bother sensitive skin. In this video, you and Emma will explore 6 castor oil mistakes before bed, how to use it more safely to support dry areas, frizzy hair, and the skin barrier, and what to avoid before adding castor oil to your nighttime routine. Number 1. Using too much can clog the skin. One of the most common mistakes with castor oil before bed is applying too much. Castor oil has a very thick, heavy texture, so it is not like a lightweight moisturizer that absorbs quickly. When a thick layer is placed on the face or acne-prone areas, it can make the skin feel trapped, clog pores, and leave the face greasy, heavy, or more irritated by morning. The most useful role of castor oil is moisture sealing. Its fatty acids help create a surface layer on the skin, supporting better moisture retention in dry areas such as the hands, heels, elbows, or knees. But sealing moisture does not mean more is better. A thick layer does not make the skin healthier faster. It just makes the skin feel like it's wearing a heavy oil coat, like wearing a winter jacket in the middle of summer. A smarter way to use it is to apply a very small amount and spread it thinly over dry areas. Avoid using it on the entire face if your skin is oily, acne-prone, or prone to clogging. For facial use, test it on a small area for 24 hours first. If itching, redness, burning, breakouts, or heat appear, stop using it. When used correctly, castor oil helps dry areas feel softer, less tight, and better supported. But when used in excess, the same oil can leave the skin heavy, clogged, and irritated. After this first mistake, the next part moves to an even more sensitive area, the eyes and eyelashes. Number 2. Applying it near the eyes can cause irritation. A very common mistake with castor oil before bed is applying it too close to the eyes or directly on the eyelids and lash line. Many people do this after hearing that castor oil helps eyelashes look thicker. But the eye area is one of the most sensitive areas of the body. Even a small amount of oil getting into the eyes can cause stinging, redness, tearing, temporary blurry vision, or a heavy feeling by morning. Castor oil has a thick texture, stays on the skin for a long time, and is harder to wash off than lighter moisturizers. While you sleep, the oil can spread from the eye area into the eyes, especially if you apply too much or sleep on your side. This does not make lashes healthier faster. It only gives your eyes an oily layer they never asked for. Very polite but completely unnecessary. A safer approach is to avoid applying castor oil along the lash line, inside the eyelids, or directly on the eyelashes. If you want to care for dry skin around the eyes, choose a product specifically designed and safety tested for the eye area. If you still want to try castor oil near the eyes, use only a tiny amount on the outer orbital bone area. Avoid the lash line completely, and always patch test first. The key takeaway is that castor oil is not eyelash growth medicine, and eye health should not be traded for an uncertain beauty trick. If redness, eye pain, blurred vision, eyelid swelling, or persistent tearing occurs after use, stop immediately and seek medical advice. After the eye area, the next part moves to another common mistake: using castor oil on hair and scalp without understanding the right amount. Number 3. Using too much on hair can make it greasy and hard to wash. A common mistake with castor oil before bed is applying too much to the hair and scalp. Because castor oil is very thick, sticky, and heavy, it can make hair greasy, leave the scalp feeling clogged, and become hard to wash out the next morning. For people with thin hair, an oily scalp, or breakouts around the hairline, using too much can make the hair look heavier rather than healthier. The most reasonable role of castor oil for hair is to seal moisture and soften dry strands. When a very thin layer is applied to the ends of the hair or to dry areas, it helps reduce frizz, tangling, and roughness. But this does not mean that castor oil makes hair grow faster or thicker, or that it treats hair loss. Hair loss is connected to hormones, nutrition, stress, scalp conditions, medications, and many other causes. One layer of oil cannot fix all of that, even though the internet loves pretending it can. A smarter way to use it is to take a very small amount, rub it between the palms, and lightly smooth it over the ends of the hair. If you use it on the scalp, test a small area first and avoid leaving it on too long if your scalp gets itchy, flaky, or easily clogged. When washing, shampoo thoroughly so that leftover oil does not leave the hair heavy and greasy. When used correctly, castor oil helps dry hair look softer, easier to comb, and less frizzy. But when used in excess, it can turn the hair into a heavy, sticky layer that is hard to clean. After hair and scalp, the next step is rough areas like heels, elbows, and hands, where castor oil is often more practical. Number 4. Works better for dry heels, elbows, and hands. If there is one place where castor oil often shows clearer value, it is on thicker, drier areas such as the heels, elbows, knees, and hands. These areas often lose moisture quickly and become rough, mildly cracked, tight, or uncomfortable, especially at night after a full day of water, soap, shoes, or dry weather. The main role of castor oil here is moisture sealing. Because it has a thick texture and contains fatty acids, it creates a surface layer that helps hold moisture better when used after moisturizer or after washing and drying the skin. This helps dry areas feel softer, less tight, and better supported while the skin barrier recovers overnight. A reasonable way to use it is to apply only a thin layer to rough areas. For dry heels, apply it after moisturizer and wear clean cotton socks to keep the oil from staining sheets. For dry hands, use a small amount to avoid an overly greasy feeling. Castor oil does not need to be applied as a heavy coating, because skin is not a cake that needs to be glazed overnight. Avoid applying it to open wounds, deep cracks, bleeding skin, infected areas, or skin that is swollen and red. Those conditions need proper medical care. When used correctly on ordinary dry areas, viewers get clearer benefits, softer skin, greater comfort, and less tightness by morning. After rough skin areas, the next step is a very important one that many people skip: patch testing before using castor oil more widely. Number 5. Skipping a patch test can trigger irritation. A mistake many people make is seeing castor oil praised online and then applying it directly to the face, scalp, or a large area of skin before bed. This is risky because, even though castor oil is natural, skin reactions can vary from person to person. Natural does not mean gentle for every skin type, an annoying but necessary truth. The useful role of castor oil is to seal moisture and soften dry areas. However, its thick texture can also cause clogged pores, itching, redness, burning, breakouts, or a warm, irritated feeling in some people. Those with sensitive, oily, acne-prone, or eczema-prone skin, or a history of cosmetic allergies, need extra caution. A safer approach is to test a small area first, such as the inner forearm or a small area near where you plan to use it. Apply a very thin amount. Leave it for 24 hours, and observe. If the skin stays normal with no redness, itching, burning, or breakouts, then use it on a larger area. If irritation appears, stop immediately and wash it off with warm water and a gentle cleanser. When viewers do this correctly, they reduce the risk of irritation. Identify safer skin areas, and use castor oil more safely in their nighttime routine. After patch testing, the final part will cover an even more important mistake: using castor oil incorrectly by mouth or treating it as a replacement treatment. Number 6. Do not drink it randomly or use it as a replacement treatment. The most serious mistake is thinking that because castor oil is useful on the skin, it must also be useful to drink. In reality, oral castor oil is a stimulant laxative, not a daily wellness drink. Misuse can cause abdominal cramps, diarrhea, nausea, dehydration, and electrolyte imbalance. Castor oil contains ricinoleic acid, a compound that acts on the intestines and stimulates bowel movement. That is why you should not randomly drink castor oil for constipation, bowel cleansing, or digestion support, especially if you are an older adult, have bowel disease, kidney disease, dehydration, unexplained abdominal pain, or take multiple medications. Pregnant women should not use castor oil to induce labor unless directly instructed by a doctor or midwife. Stimulating uterine contractions and causing severe diarrhea can create risks for both mother and baby. Childbirth is not a weekend do-it-yourself project, although social media keeps trying to turn everything into a quick hack. A safer way to understand this video is to treat castor oil mainly as a topical product for dry skin areas, frizzy hair support, and gentle massage if your skin tolerates it well. If you are dealing with constipation, abdominal pain, fungal infection, wounds, sleep problems, or long-lasting health issues, seek proper medical guidance. If you found these safety tips helpful, subscribe to FreshFuel Guide so you never miss science-based nutrition and wellness guidance. After these 6 important lessons, one big question remains: how do you use castor oil before bed in a way that delivers benefits without unnecessary risks? Up next is the ultimate health hack, where we bring everything together and reveal the 3 most common mistakes to avoid. When using castor oil before bed, the most important rule is to use very little, apply it to the right area, and keep it away from the eyes. Castor oil has a thick texture and is rich in fatty acids, helping seal moisture and soften dry areas, such as heels, elbows, and hands, as well as frizzy hair ends. But if you apply too much, it can clog the skin, leave hair greasy, and irritate the eyes. A safer way to use it is to take a very small amount, about the size of a small pea. For each dry area, spread it thinly on heels, elbows, hands, or hair ends. If using it on heels, wear clean cotton socks to avoid staining your sheets. Do not apply it close to the eyelids, inside the lash line, on open wounds, infected areas, inflamed acne, or irritated skin. There are 3 mistakes to avoid. The first mistake is applying too much to the face or scalp, which can clog skin, trigger breakouts, make hair greasy, and become hard to wash out. The second mistake is applying it near the eyes in hopes of thicker lashes, which can cause stinging, redness, or temporary blurry vision. The third mistake is drinking castor oil randomly for constipation, bowel cleansing, digestion support, or labor induction. Oral castor oil is a stimulant laxative, not a daily wellness drink. Before using it more widely, perform a patch test on a small area of skin for 24 hours. If redness, itching, burning, breakouts, or heat appears, stop using it. If you are pregnant, have bowel disease, kidney disease, unexplained abdominal pain, dehydration, take multiple medications, or have very sensitive skin, talk with a healthcare professional first. So which area would you use castor oil for first? Dry heels, dry hands, or frizzy hair ends? Comment on one of those 3 choices below. Thank you for watching, and I'll see you in the next video.